Welcome back to our interview with Dr. Kenneth Iserson, author of Getting into a Residency, a Guide for Medical Students, now in its 8th edition. Dr. Iserson, why do some MD program directors discriminate against DOs?
This reflects old attitudes when DO and MD training differed considerably. Of course, now they're virtually the same. The discrimination really varies by the part of the country and by the specialty. Areas where there's lots of DOs in practice and there's DO medical schools have much less discrimination than other parts of the country where DOs are fairly scarce. The specialties that most discriminate are surgical specialties and general surgery.
Will taking the USMLE help DOs get an MD residency position?
DO students would optimally like to take both COMLEX and the USMLE. COMLEX is a little easier to pass than the USMLE, so that will help you if you're not the best student in the world. The problem is that MD residency directors have a hard time interpreting the scores from COMLEX and then using those scores to compare against students who have taken the USMLE. So, what you want to do if you've taken the COMLEX or only taken the COMLEX is to send the official information sheet that came with your scores to the programs, and then include a cheat sheet of how to interpret the scores and how you've done in your career.
Can an osteopathic medical student or graduate participate in the National Residency Matching Program known as the NRMP?
Yes, you can participate in the NRMP as an independent applicant. In fact, over the last 25 years, the number of DOs that have gone through the NRMP match and actually matched has increased 250%. However, there are some programs that basically don't want to hear from DOs. These are neurosurgery, hand surgery, ophthalmology, orthopedic surgery, otolaryngology, pediatric surgery, plastic surgery, thoracic surgery, and urology. So most DOs in those specialties go through AOA-approved programs. However, there's current negotiations between AOA, ACOM, and the ACGME so that there's a good chance that starting in the match in 2015, there'll be one match and all programs will have both AOA and ACGME approval. They'll be unified.
How will that affect DO students?
Things are about to change dramatically. If all goes according to plan, those graduating in 2015 will find that all programs are both AOA and ACGME or MD approved, meaning that all DOs will qualify for all programs. This will allow DO students to have sufficient spots in all the different specialties so that they will be able to get a position.
What will happen to the osteopathic training programs?
So, as of 2015, all currently AOA approved programs will also be ACGME approved. The difference is that current AOA programs will retain the expected competency in OPP and OMM, and of course, those independent programs will continue.
How do DO students get the newest information about these changes?
This is a fluid situation, so DO students should look for new updated information, and they can find it on the inside the AOA page on the AOA's main website.